Hey everybody, hope everybody's internship is going great. My name is Melissa Duran and I'm currently doing my internship at Jackson Memorial Hospital. I work with individuals with spinal cord injuries that have basically faced life-changing experiences that would change their life. It's been truly a pleasure working at Jackson Memorial Hospital as their intern. I truly enjoy it. My supervisors, everybody there is so friendly and very welcoming. So I have no regrets there. So basically, I'm going to talk a little bit about the questions that we have to answer. So the first question, did this final internship make or break your decision on whether you want to work in the field? This final internship has opened up my eyes a lot with the recreational therapy field. I truly have a lot of respect for it, and I truly want to stay in this field for a while. It's taught me a lot about the field. It's taught me a lot about basically how recreational therapy and the benefits and how much of a positive it makes on individuals' lives, and I truly respect that and I truly love it. If you had the option of choosing your internship site, would you choose the place where you are at now? Yes, I would definitely choose Jackson again for my internship too. For my resume, I kind of wanted to be diverse. I wanted to basically kind of spread it out and work in different type of with individual disabilities. My first internship, I did it with Miami-Dade Parks and Recreation with individuals with disabilities. I worked with basically autism and Down syndrome. I did that for my first 4 weeks, and it was truly awesome working in there. I get a lot of experience there with individuals with autism and Down syndrome. My second rotation, I decided to do with the Veterans Nursing Home, basically working with individuals with dementia and Alzheimer's. I wanted to have an idea of, excuse me, I wanted to have an idea of basically working with older adults and with that type of disability. And for my second internship, I wanted to work with people with physical disabilities, and that's why I kind of applied for Jackson Memorial Hospital. For that, I could work with individuals with spinal cord injuries. And honestly, I truly, I'm glad and honored for them to choose me as their intern for the summer. They've been so welcoming, and I truly enjoyed it. What is the hardest goal to document or progress notes to write? What method was used? So I basically, during my trip, wrote a couple of different type of documentations. For example, progress notes, discharge summaries. I have looked at discharge summaries. I have done initial evaluations. I have done assessments. I've done several different type of documentations in recreational therapy. I struggled at first with progress notes in the beginning of my internship, but towards the end of my internship, I started to finally understand the process and understand how SOAP is used into the progress notes, basically meaning subjective, objective, assessment, and planning. I've gotten a lot better in my progress notes, and I've learned so much more about documentation, especially in a clinical setting, than I did in a community setting. So I'm truly like the documentation process. It's pretty tedious, but I do like it because it gives you an understanding of your patient, and basically if you need to make adaptations or how the patient is basically it's what very important is recreational therapy. If a client misbehaved or didn't follow the rules, were there any disciplinary tactics used to adjust the client's actions? Well, I didn't have that many I didn't have any aggressive patients or any residents that are aggressive. I had some of them that would kind of get distracted during activities, and one of my main things I tried to do was try to basically encourage them or try to guide the conversation back into the activity and have them back to, okay, let's focus back on the activity. Let's focus on what is at hand right now. That was basically what I tried to did. There was never disciplinary tactics used to basically if they did any bad actions, because they never did. It was just basically getting off topic easily. So it's basically just redirecting them back into the activity is what I mainly focused on. And of course I try to do that in the most respectful way as I possibly can. Did any residents, clients ever get aggressive with you? No. I've never, all the residents have been very nice. The most I've ever had that wasn't even aggressive was basically just not caring at all about recreational therapy. I tried speaking to him a little bit about what our role is and what we do and how we incorporate into their therapy. He clearly had no interest with it. He was on his phone. So then I kind of just let him be, but I still try to incorporate programs or activities for him. That was basically the closest that I ever got to basically misbehaved or so. But other than that, I have never had any aggressive residents that have approached me at my internship for the last 13 weeks. How can recreational programs, activities department incorporate clients into the local community? Okay. At Jackson, they're very encouraging about community reintegration, basically trying to reintegrate an individual back into the community after they have experienced a life-changing event in their life. You know, a lot of the individuals sometimes, you know, we try to basically encourage them to go out there as outpatients to basically going back into the community. In inpatients, we provide actually a document that basically tells them what activities, what programs are offered out there in the community. I usually try to ask them like what area, excuse me, what area are they they're living in right now, and I try to find basically activities or programs that are offered in the community for them, and I try to get their interests, their hobbies. What do they like? Do they like hand cycling? Do they like sailing? Do they like to go ice hockey? Do you want to play rugby, wheelchair basketball? I basically try to Google and I look up for programs that are close to them that they could join, you know, and that's one thing we give to them when they're inpatient, when they're about to leave for or be discharged from the hospital. I try to get that document for them, and basically we try to incorporate them into our email blast, which is basically an email that's a weekly email that's sent, basically then letting them know about what activities or what programs are being offered during the week and during the weekend, and that they should come and join and stuff. They're very focused on reintegrating back into the community at Jackson. So basically we incorporate like outpatient dinners. Basically we like them to meet us at the place that we go to. And if they don't, then we'll take them to the Metro Rail, show them how easy it is to get in the Metro Rail, how easy it is for them to just go from point A to point B. If they're trying to get somewhere, we try to introduce them to STS, different type of programs out there. So what RT program offered at your agency is most beneficial for the population you worked with? One of the programs that I highly enjoyed, and I really do enjoy, is the aquatics program. You know, basically what this aquatics program is every Thursday. You have the morning session and you have the afternoon session. The morning session is basically with individuals with that are paraplegics. Basically we work with them that they're the more higher functioning. We even have one quad, but she's very high functioning. So we basically do exercise class. We work out the arms, the legs. We practice floating. We practice swimming. We practice walking. You know, with the walking, we use noodles to put under their arms. That's why they won't be falling into the water. You know, we bring in a walker into the pool. Sometimes they do a lot good with the walker. Even if we practice standing and stuff, basically to get the pressure off of you know, their lower backs and stuff, they'll be able to like kind of like work out those the muscles that they tend to not use that much. It's a great program, and a lot of individuals have benefited from the program. For the last 14 weeks, I've seen a lot of improvements in a lot of the patients, and basically not walking, but like raising their knees. You know, before when they came into the water program, when they're out of the water, they couldn't raise their knees that well. And towards the end of the end of my internship, you know, I see them when they get out of the water that they're able to raise their knee a little bit because they've been starting to work out those muscles. In the afternoon, we basically work with individuals that have lower functioning, so basically our quads. And it is truly incredible and awesome to see it. There's one quad there that she's a low functioning. We've been trying to teach her how to float, and she's actually been able to float. You know, she'll lay on her back. We practice on breathing, and we're also practicing on basically when you're floating in the water, you would like to turn your head a little bit to the right. That's how you could kind of situate your body and balance it in the water. That's how you don't just roll over. We're usually with her. We help her. We use the noodles to help her with her balance if she struggles with her balance. We actually got this cool mask that basically covers the whole entire face, and she can use it as a snorkel. So when she's flipped over, basically the airways is basically towards the back, and then you have the mask in the front that covers her whole entire face. And she truly enjoys that. She loves being under the water. She loves snorkeling. And she's also able to move her arms a little bit high. So we're trying to teach her how to do the elementary kind of like backstroke, basically going like this, you know, just swimming with her arms, just raising it, doing the T. just basically encouraging her to swim and stuff, and she's been improving, and she's been learning how to swim adaptively, and it's truly remarkable and inspirational to see her to do so well. So that's one program that I feel is like very beneficial for people with spinal cord injuries. So yeah, what valuable characteristics did you observe from your internship supervisor that you believe is crucial to being a recreational therapist? I've learned a lot from my supervisor. She's taught me a lot, like being, having that confidence in your activities. When you're leading the activity, have that confidence. If you have ideas that you want to try out, try them out. I highly recommend that if you do have ideas, try it out before you do the activity. That's right, you know that it works, instead of doing during the activity and then being like, oh, I gotta adapt and I gotta change it. So basically knowing the activities, always be prepared. That is very crucial. Make sure that you could try to avoid anything from going wrong. You want to make sure that you have all the material that you need at that moment. You want to make sure that if you need to make all the adaptations that you need to for an individual, that you have the adaptations. Knowing your patients and knowing what programs that you're basically incorporating into their therapies, you need to understand what are their restrictions. Do they have a TLSO? Do they have the Miami J collar on? Make sure that you know what the restrictions. They cannot bend. They cannot lift 5 pounds. They cannot twist their body. You need to incorporate that. Maybe they might not be able to use their hands. Make sure you have adaptive equipment to include them into the activities. Creating adaptations for them. So that's one of the characteristics that I learned, that you need to know your stuff. You need to know what you're doing, what you're leading. You need to also be very respectful to your OTs, your PTs. Show respect in order to get respect back. I feel that's one of my main things that I feel that's very important, especially characteristics. Also, understanding how to offer programs to the individuals and stuff, I feel. But what do you like most about the therapeutic recreation department in your agency? What I like most is seeing the patients, how they get better. We've had individuals that come from motor vehicle accidents, when they first start their therapy, and then how they get to their outpatient, and even seeing them as outpatients in the aquatics program. I feel it's definitely something that I really like, and also I love the aquatics program, especially participating in it has been awesome. So that's one of the things I like about therapeutic recreation. Being a full-time at your internship, did you gain more knowledge about recreational therapy? Yes, I have gained more knowledge through my second internship, and I felt like it's given me more of a confidence in basically leading activities and knowing what I'm doing in recreational therapy. My supervisor, when I first started my internship, she told me, oh, by the end of this internship, I want you to basically act as if you're the recreational therapist here and I'm your assistant, kind of. So I know she didn't baby me. She's one of those that you got to do it. You got to figure it out and got to learn how to do activities. You need to learn from mistakes that you make and how to change them and stuff. So I truly enjoyed being at Jackson Memorial Hospital. And also knowing more knowledge about RT is kind of like, I felt it was great that she wasn't babying me, that she was just basically telling me like, okay, you need to know your stuff in recreational therapy. And I truly enjoyed that because I learned so much more. I built more confidence in myself as a recreational therapist. I improved in my documentations. She was there to help me to basically teach me a little bit about the documentations and how they're supposed to be done and stuff. So I truly gained more knowledge about the documentation there, and as well as to the patients, making sure that you know who they are, what their adaptations are, what you need to include into their therapy and stuff. I thought that was very beneficial for what I'm learning. What skills have you learned that you feel will benefit you most as a recreational therapist? Always be prepared, especially during activities, during programs. Safety is very important. Always make sure that your patients are in the way, like, they're always safe. No matter what activity you're doing, that is safe. It is adaptable for them. If they need the adaptations. If they don't, then you don't have to worry about it. But just knowing your patients and knowing what they like, what hobbies they like, and trying to incorporate that into their therapies. That's one of the skills that I've learned is to be very respectful. Know your stuff. Learn ideas. Always open your mind to education. Know more. You go on the computer, basically Google a lot. You find out more education about different programs or different ideas and stuff. It's good to be educated on what other programs or what other ideas that are out there to basically adapt different activities and stuff. I feel like that's very important. That's something I've learned, that always, no matter if you're in your field, you're always going to be educated, and you need to always continue to be educated. And it is very important to always be researching, looking at new things, seeing what the technology is out there and how much it could improve in someone's life. But yeah. So that's all the questions I believe I answered. And I wanted to wish everybody congratulations on finishing your internship 2. We're finally going to be graduating in a week. Well, officially, we already graduated, but in a week we're finally going to be finished. And I'm wishing everybody the best of luck as recreational therapists. Thank you for watching my video, and I hope you guys have a great one. So, bye guys. Hope to see you in the future. Bye.